Hello, my name is Jeff. Since you are here, subscribe so you can leave a comment, like or even ask a question. Today's video talks about the signs of a fatty liver. Watching this video will discuss how you may reverse fatty liver disease if you have it. I'm just an ordinary dude, not a doctor or anything. Advice I give is always intended to be helpful and risk-free. I am not a medical professional, so please check with your own physician before trying anything you see in this video. The first order of business is to define fatty liver disease. A hallmark of this condition is the accumulation of fat in liver cells. The liver plays an important role in the body. Additionally to storing vitamins and minerals, the liver also produces bile and urea and acts as a blood purifier. Inflammation results when the liver is overworked processing excess fat. Antibodies formed as a result of this process have been shown to target and harm liver cells. Damaged liver cells are unable to function at the same level as their healthy counterparts. This prevents the liver from carrying out its other functions, which results in an overall increase in body fat. This is known medically as hepatic steatosis, also called fatty liver disease. Fatty liver disease is the most common form of non-alcoholic liver disease. It's normal for the liver to have some fat, but it shouldn't make up more than 5 to 10% of the organ's mass. The liver is safe if the percentage is low enough. Deterioration in liver function is accompanied by cirrhosis, a condition characterized by scarring of the liver as a result of excessive fat accumulation. Now that we know the potential consequences of a fatty liver, I think it's time to discuss the signs and symptoms. The liver's main function is to metabolize and eliminate foreign substances, such as food, medication, and harmful chemicals, that have entered the body. It is also responsible for processing bodily secretions like sweat, pee, poop, and tears. Hepatic enzymes that cause harm. Studies show that abnormal liver enzyme levels occur in over 50% of patients with fatty liver disease, AST and ALT. An increase in the activity of these enzymes may be the end result of the liver storing an abnormally large amount of fat. Fatigue. If you have trouble getting motivated to exercise, are constantly exhausted, and have weakened muscles, fatty liver disease may be to blame. Liver disease can cause fatigue and decreased productivity. A 2008 study found that people with fatty liver disease were more tired than those without the disease. Given the liver's central role in cellular energy production, this makes perfect sense. The liver and other fat storage organs like the skeleton, adipose tissue, nervous system, and intestines have a two-way conversation. The accumulation of fat in the liver interferes with this signaling, leading to problems in the skeletal muscles, the gastrointestinal tract, and the nervous system. Insufficient liver enzyme production leads to a buildup of this fatty acid. Problems digesting food are causing discomfort. Accumulation of fat or excess fat in liver cells is the root cause of liver cell inflammation. Inflammation provokes immune cells to act aggressively. Tissue. Tissue damage can lead to fluid retention. The right upper abdomen, close to the liver, is a common location for swelling-related pain or discomfort. Painful stones in the bile ducts can form as a result of fatty liver disease. Curbing your hunger and losing weight. Hormones that regulate hunger are disrupted in cases of severe liver damage during the fat accumulation phase. Leptin is a hormone that regulates appetite and reduces hunger pangs. When leptin concentrations are extremely high, lack of appetite and weight loss are possible side effects. Decreased belly fat and digestive issues. Gastrointestinal disorders affect the digestive system as a whole, from the esophagus to the stomach to the small intestine. In 2019, researchers examined the digestive tract. The symptoms of cirrhosis of the liver are being analyzed. Gas and abdominal pain were the most common complaints. Only about a third. In addition, 13% of people experienced diarrhea or watery stools. 8% of patients were affected by constipation. Reflux and nausea are symptoms of acid reflux. A study from 2009 found that gastroesophageal reflux disease is more common in patients who had a condition characterized by excessive fat accumulation in the liver were more likely to have reflux than those who did not. Heartburn and flatulence were also more common in this group of patients. Gastroesophageal reflux disease is characterized by the regurgitation of stomach contents into the esophagus. One of its possible negative effects is making you feel queasy. Toxicity from waste and other materials also plays a role. Damaged digestive tract and food pipe mucosa due to acid reflux because it is not processed by the liver. Bleeding and bruising are guaranteed. Platelets, a type of blood cell that aids in clotting in the event of excessive bleeding, are produced in the liver. Platelet count drops as cirrhosis progresses. Cases of fatty liver disease that have progressed to an extreme state. If the blood does not clot properly after an injury, there will be bruising and possibly bleeding. Besides jaundice, itching, and swelling are also possible side effects. Now you know. Fatty liver has 7 telltale signs. To be sure what's going on with your liver, get tested with a blood test, ultrasound, or biopsy if you're experiencing these symptoms. Only by altering one's diet and daily routines can this manufactured illness be remedied. Now I will share one more things you can do to stop the progression of fatty liver disease and even reverse its effects. Regularly engaging in physical activity. Exercising in an aerobic fashion, such as jogging, running, or walking. Exercising with an emphasis on aerobics, such as bicycling or dance workouts like Zumba, can increase calorie expenditure and decrease fat production in the liver. You need to cut back on your alcohol consumption. When one drinks alcohol, the liver takes a hit. Exactly how does the liver process alcohol? An enzyme is required to convert ethanol into a poisonous compound. Acetaldehyde, or acetaldehyde for short, is a carcinogenic substance. Consuming high-fiber foods is recommended. Lipids in the blood, including triglycerides and the bad LDL. Be sure to eat at least 5 servings of fruits and vegetables each day. Get your veggie intake up. Include other high-fiber foods, such as oatmeal, in your daily diet. Gluten-free oats, quinoa, millet, and other similar grains. Cut out the sugar. Particularly in people with prediabetes and type 2 diabetes, consuming an excessive amount of sugar can cause blood glucose levels to rise. When blood glucose levels are consistently high, additional fat stores are likely to be created. Don't consume processed foods or store-bought fruit juice as well as packaged meals and snacks. In the liver, fructose is instantly converted into glucose, which can lead to health problems. Read labels and steer clear of foods that contain high fructose corn syrup to avoid eating processed foods. Many different names, including glucose fructose, fruit syrup, maple syrup, agave nectar, and fructose crystals, are used to sell HFCS. Always put your emphasis where it belongs. A condition characterized by excessive fat accumulation in the liver can be reversed by losing as little as 10% of your current weight. Don't use drugs if you can help it. The liver is responsible for most detoxification processes, drug metabolization, and byproduct formation. A buildup of fat cells in the liver and an increase in inflammation can result from taking multiple medications at once. Happens when fat accumulates in the liver. Maintain a balanced diet. Adopting a balanced, healthy way of life. An individual's eating habits are crucial. Foods are a source of energy because the liver can convert a surplus of carbohydrates, protein, and fatty acids into fat, and a fatty layer develops. The following are the top 10 foods for reversing. Consume foods like broccoli, cauliflower, kale, artichoke, turmeric, coffee, milk thistle, and walnuts that support the liver's detoxification processes. Watch our other videos about liver health. If you liked this video, please show your appreciation by clicking the like, share, and subscribe buttons. Do you want to make a comment? Getting in touch with us?